Do older people smell different? 6 facts about changing body odor for seniors caregivers. Have you ever noticed that as people age, their smell changes? It's something most of us don't like to talk about, but it's real. Maybe you've noticed it with a parent, a grandparent, or even a close friend. Suddenly, they don't smell the same way they used to. But here's the thing, it's completely natural, and it doesn't mean someone isn't taking care of themselves. In fact, body odor changes are often a natural part of the aging process, but we rarely talk about why it happens. I know it can be an awkward topic, trust me. But if you've ever been in the position of caring for an older loved one, or if you're a senior yourself dealing with these changes, it can sometimes feel isolating. You might even feel embarrassed or unsure of how to handle it. But here's the truth. Understanding why this happens, what's behind it, and how to manage it with care can make a world of difference for both seniors and their caregivers. So today, let's break that silence. In this video, we're going to dive into 6 surprising facts about why older people's body odor changes. And most importantly, we'll talk about how you, whether you're a caregiver, a family member, or a senior yourself, can approach this issue with understanding, empathy, and practical solutions. It's not about fixing a problem, it's about creating comfort, dignity, and connection in the journey of aging. Are you ready? Let's dive into the science, the truth, and most importantly, how to take care of our loved ones and ourselves through this very real experience. You'll be amazed by how much there is to learn. Part 1. Natural aging process affects sweat glands. As we get older, our bodies go through a lot of changes. Some of them are more visible, like wrinkles or gray hair, but others are a bit more subtle. One of those changes involves our sweat glands, the very things that help us keep our bodies cool and regulate temperature. You might not realize it, but these sweat glands actually start to become less active as we age, and that can lead to a change in how we smell. You see, our skin has 2 types of sweat glands, eccrine glands and apocrine glands. Eccrine glands are responsible for cooling us down and producing the clear, odorless sweat that we're all familiar with. Apocrine glands, on the other hand, are found mainly in our underarms and groin area, and they produce a thicker, more odorous sweat that's affected by our hormones. As we age, our eccrine glands become less efficient at producing sweat, meaning that older adults may sweat less overall. And here's where things get interesting. When you sweat less, the natural oils and bacteria on your skin interact differently, and this can change the way your body odor smells. Now, this doesn't mean that seniors are any less clean or hygienic. In fact, it's not always about how often someone showers or what deodorant they use. It's about the natural changes happening in their bodies. And honestly, this is something that's so often overlooked. I remember the first time I noticed this with my own grandmother. She used to be meticulous about her hygiene, but as she got older, I noticed a shift in how she smelled. It wasn't unpleasant, just different. At first, I didn't know how to handle it, but then I realized it wasn't her fault. It was simply her body aging in a way that was completely natural. Takeaway: aging affects the sweat glands and the way our bodies produce sweat, which directly influences body odor. It's not something to be ashamed of. It's just the natural course of things. Part 2. Hormonal changes and their impact on body odor. Now let's talk about hormones. I'm sure you've heard the phrase, hormones are a game changer, right? Well, that's especially true when it comes to body odor as we age. In women, menopause brings about a dramatic shift in hormone levels. As estrogen levels drop, the body goes through all sorts of changes, and one of the less talked about effects is how it can alter body odor. You might have noticed that menopausal women sometimes experience hotter flashes, night sweats, or changes in how their body smells. This is because estrogen and progesterone play a significant role in regulating how our body odor develops. With menopause, this balance is disrupted, and it can lead to an increase in body odor or a shift in the way it smells. Men aren't left out of the hormone change party either. As men age, testosterone levels naturally decline, and this too can contribute to a shift in body odor. Testosterone influences sweat production, and as these levels decrease, it can lead to changes in how sweat is produced and how it interacts with the bacteria on the skin. For some men, this might mean their body odor becomes stronger, or it might take on a different scent. I'll never forget when my father started noticing this in himself. He's the kind of person who never really sweats much, but as he hit his late 60s, I started noticing a new, unfamiliar odor. At first, he was self-conscious about it. I reassured him that it wasn't anything he was doing wrong. It was just his body changing, and it was completely normal. The takeaway here is that hormonal changes during menopause for women and a decrease in testosterone for men can significantly affect body odor. It's not about cleanliness, it's just biology at work. And if you're caring for someone who's going through this phase, it's important to understand that this change is completely natural and not something they have control over. Takeaway: hormonal changes, whether it's menopause for women or a drop in testosterone for men, play a huge role in altering body odor. It's just another part of the aging process, and it's essential to approach it with care, understanding, and patience. Part 3. Medications and their effect on body odor. Let's talk about something else that often gets overlooked when we think about changes in body odor: medications. As we get older, many of us start taking medications to manage chronic conditions, improve health, or reduce symptoms. What you might not realize is that some of these medications can actually impact how we smell. You see, medications like antibiotics, blood pressure drugs, diabetes medications, and even those for pain management can all affect body odor. Certain medications change how our body processes sweat or alter the balance of bacteria on our skin, making body odor more noticeable or sometimes even giving it a different scent. For instance, antibiotics, while helpful in fighting infections, can alter the natural bacteria on your skin, leading to stronger or more distinct body odor. And here's the thing: most of us don't make the connection between a new medication and a sudden shift in body odor. For many caregivers and family members, this can be confusing or even concerning. But if you dig a little deeper, you'll realize that it's a side effect that can be managed or, in some cases, minimized. I remember when my uncle started a new medication for his diabetes. He was doing great overall, but I noticed that his usual scent had changed. It wasn't unpleasant, just different. When I looked into it, I learned that the medication could cause certain side effects, including changes in body odor. Once we understood the connection, it became easier to talk about it openly and address it. Sometimes the simple solution was just making sure he stayed hydrated more, or we'd switch his deodorant to one with stronger odor-fighting properties. Takeaway: medications can significantly alter body odor, but it's important to recognize that it's often a manageable side effect. If you notice changes in body odor after starting a new medication, don't hesitate to talk to a doctor or pharmacist about possible alternatives or adjustments. And if you're a caregiver, this is a perfect moment to show your loved one that their health and comfort are your priority. Part 4. Poor hygiene and skin health. Okay, let's get a little more practical now. One of the most common factors that can affect body odor as we age is hygiene. But here's the thing: this isn't just about being clean or taking regular baths. It's also about the overall health of the skin, which can change with age. As we grow older, our skin becomes thinner, drier, and less efficient at holding moisture. This can lead to dry patches, flaky skin, and a less effective barrier against bacteria. And when bacteria interact with sweat on dry skin, the smell can be a little more pronounced. It's not that the person isn't trying to stay clean, it's just that their skin doesn't function the way it used to. Additionally, Many seniors may struggle with mobility, which can make regular hygiene routines more difficult. I remember a time when my grandmother started to feel self-conscious about her hygiene. She couldn't take as many baths or showers on her own anymore, and that made her feel embarrassed. I'd gently help her with her hygiene routine, and I realized how much better she felt afterward, both physically and emotionally. It wasn't just about the smell, it was about helping her feel dignified and comfortable in her own skin again. And here's something else. Poor skin health can also result in the overgrowth of certain bacteria or fungi, especially in areas like the armpits, groin, or feet. When these bacteria start breaking down sweat, they can produce odors that are more pungent. Regular moisturizing, gentle cleansing, and even using antibacterial wipes or lotions can make a world of difference for seniors struggling with hygiene. Takeaway: poor hygiene due to dry skin or limited mobility can make body odor worse. But with some extra help and the right products, caregivers can help seniors manage this issue. It's not about pointing out that someone smells. It's about making them feel cared for, dignified, and supported. Part 5. Dehydration and diet influence. Body odor. All right, let's talk about something that's often underestimated: hydration and diet. You've probably heard that drinking water is good for you, but did you know it can also impact how you smell? Dehydration can cause body odor to become more noticeable, and here's why. When your body is dehydrated, your sweat becomes more concentrated. This means that the sweat that your body does produce contains more waste products, like urea and ammonia, which can contribute to a stronger smell. Your body tries to flush out toxins through sweat, and when you're not drinking enough water, it becomes harder for your body to eliminate those waste products efficiently. The result? A more pungent body odor. For older adults, staying hydrated becomes even more critical. As we age, our sense of thirst can diminish, so seniors might not feel the urge to drink water as often. This can lead to mild dehydration, which then leads to stronger body odor. But here's the good news. It's something that can be easily fixed. Reminding seniors to drink water regularly, or offering hydrating foods like fruits and vegetables, can make a big difference in managing body odor. And speaking of food, let's not forget about diet. Certain foods, like garlic, onions, curry, and even coffee, can alter body odor. While these foods might have amazing health benefits, they can sometimes make your sweat smell a bit stronger or more pungent. In some cases, it can be a bit of a balancing act to find the right foods that work for someone. I remember my aunt, who used to always enjoy a cup of coffee in the morning. She'd complain that she didn't smell as fresh after having it, so I suggested she try cutting back for a few days. The difference was noticeable, and we figured out that her body was more sensitive to certain foods as she got older. Takeaway: hydration plays a huge role in managing body odor. Staying hydrated helps flush out toxins and prevents that concentrated sweat smell. Also, be mindful of certain foods that might exacerbate body odor. It's a simple yet powerful way to support the health and well-being of older loved ones. Part 6. Chronic conditions and their effect on body odor. Now let's dive into something a little more serious: chronic conditions. For many older adults, chronic health issues like diabetes, kidney disease, liver disease, and even metabolic disorders can have a significant impact on body odor. And this isn't just about sweat. It's about the way the body is processing waste. For instance, diabetes can sometimes cause a sweet, fruity smell in a person's breath or sweat because of high blood sugar levels. When the body is unable to properly regulate glucose, it can lead to a condition called ketoacidosis, which produces a distinct odor. Similarly, kidney disease or liver disease can cause the buildup of waste products in the body, and these waste products can escape through sweat, causing a noticeable odor. I'll never forget when I noticed this with my grandmother. She had been struggling with kidney disease for years, and one day, I noticed that her body odor had changed. It wasn't just the usual aging changes. I could tell something was off. After speaking with her doctor, we learned that her body was retaining toxins because her kidneys weren't functioning as well as they should have been. It was a tough conversation, but it helped me understand how crucial it is to monitor chronic conditions and work with healthcare providers to manage these symptoms. It's important to understand that changes in body odor due to chronic conditions are not something that can be controlled by hygiene alone. They require medical attention. So, if you notice a sudden shift in odor, especially if it's associated with other symptoms, it's important to speak to a healthcare provider. Takeaway: chronic health issues like diabetes, kidney disease, and liver disease can alter body odor in noticeable ways. If you're a caregiver or a family member, understanding this is crucial, and seeking medical advice is key to managing these changes in a way that supports the individual's health and well-being. Part 7. How to address body odor in seniors. Practical tips for caregivers. Now that we've covered the science behind why body odor changes in older adults, let's get to the practical part. How can you help manage body odor in seniors? If you're a caregiver or a family member, you might feel unsure about how to approach this sensitive topic, but don't worry. I've got some practical tips that can make a big difference in how your loved one feels and how they smell. 1. Simplify bathing and hygiene routines. Bathing can become more difficult for older adults due to mobility issues or health conditions, but hygiene is still crucial. There are ways to make this process easier and less stressful for both you and your loved one. For example, bed baths or using no-rinse body wipes can be a great alternative for seniors who find it difficult to stand in the shower. These wipes are a quick and easy way to freshen up, especially if the person is bedbound or struggling with movement. For those who can bathe or shower independently, make sure they have non-slip mats and grab bars to prevent accidents. A comfortable, safe bathing experience can not only help with cleanliness, but also improve their dignity and confidence. 2. Use gentle, effective hygiene products. Choosing the right products is key. Look for fragrance-free or hypoallergenic soaps and deodorants to prevent skin irritation, which is common in older skin. Some products are formulated specifically for sensitive skin, and using these can help manage body odor without causing discomfort. Also, antibacterial body washes can help eliminate the bacteria that contribute to body odor, especially in areas like the armpits, feet, and groin. Keep in mind that using products that are too harsh or heavily scented can irritate sensitive skin and make the issue worse. 3. Encourage hydration and healthy eating. As we talked about earlier, hydration is key to controlling body odor. Make sure your loved one is drinking enough water throughout the day. Sometimes, setting reminders can be helpful. Also, try offering fruits and vegetables as hydrating snacks. They're packed with water and essential nutrients. When it comes to diet, encourage a balanced, healthy meal plan. While some foods, like garlic or spicy dishes, might make body odor stronger, a well-rounded diet rich in fiber, antioxidants, and healthy fats can support overall health and reduce unpleasant smells. 4. Invest in comfortable, breathable clothing. When managing body odor in seniors, clothing choices matter. Clothes made of breathable fabrics, like cotton, can help reduce sweat buildup and prevent body odor from lingering. Encourage your loved one to wear loose, comfortable clothing that allows air to flow freely. Changing clothes regularly, especially in hot weather, can also help manage odors. When it comes to bedding, make sure that linens are washed frequently and that the room is kept cool and well ventilated. 5. Stay on top of medical care. Remember, body odor changes can sometimes be linked to underlying health conditions. If you've noticed a significant change in your loved one's odor, and especially if it's accompanied by other symptoms like fatigue, nausea, or changes in their behavior, make sure to reach out to their doctor. Regular checkups and being proactive about their health can help address any medical issues early on. Takeaway: Helping manage body odor in seniors is a combination of practical solutions like simplifying hygiene, staying hydrated, choosing the right products, and making sure their health is a priority. It's all about creating an environment where they feel comfortable and cared for, and that starts with small, thoughtful actions. Part 8. Conclusion. The importance of compassionate care. As we wrap up, let's take a moment to reflect on what we've talked about. Body odor changes in older adults are part of the natural aging process. Whether it's due to hormonal shifts, medications, dehydration, or chronic health conditions, these changes can sometimes feel uncomfortable for seniors, and caregivers too. But the key takeaway here is this: compassionate care is essential. Body odor is just one aspect of aging, and it's something we can approach with empathy and understanding. As caregivers, we are not just tending to physical needs. We are showing love, respect, and dignity to the people who have taken care of us throughout our lives. It's easy to feel embarrassed or unsure about how to handle these changes, but addressing body odor with kindness, patience, and practical solutions is the best way to support our loved ones. Whether it's helping them with hygiene, making sure they stay hydrated, or providing a safe and comfortable space for them to live in, every little action counts. And if you're a senior watching this video, I want you to know that your dignity and comfort are incredibly important. If you're struggling with changes in your body odor, know that it's a normal part of aging, and there are many ways to manage it. Takeaway: aging comes with a lot of changes, some of which can be difficult to deal with. But by approaching body odor changes with understanding and practical solutions, we can make the aging process a little bit easier for our loved ones and ourselves. Let's continue to treat the people in our lives with the love and care they deserve, no matter what challenges come their way.